Moving on to the last segment of today's event, how to pass MD, OHT and communication, may I call upon moderator Dr. Tushar Matthias to call upon the speaker onto the stage. Thank you.
So now we come to the last segment of the day. And you know, for a long time, SIMCON has been holding this How to Pass MD segment, specially aimed at the trainees. So to kickstart the day with this program, we have two things. The first one is going to be an history-taking station, and the second is going to be a communication skill. So we'll have the program just like in the exam, with half an hour and half an hour dedicated for the two sessions. So I would like to invite Prof. Udaya Ralapanawa, who is going to be our examiner for the session today, and our volunteer registrar on stage, who is Subani, and our surrogate Shehani. In order to save time, we've actually given the case to the registrar. So as the candidate gets the case for the next 5 minutes to read through, you all also will get the case appearing on the screen. We can start now.
Hello, I'm Subani. I'm a doctor who works
Subani, you can take 5 minutes. If you haven't read it before, you can take 5 minutes to look at it. Subhani, you can start now.
Hello, I'm a doctor who works in this unit. I'm Subhani. And may I just confirm this information? Are you Mrs. Shashikala Nimanti?
Yes, doctor.
And how old are you?
I'm 38 years
Okay,
old.
so I'm hoping you're comfortable with the setting and
Yes.
with the language.
Yes,
So may I ask what brought you to the hospital in the first place?
Well, doctor, I've been having a fever for the past 4 weeks.
Okay, and what else?
And I feel fatigue,
Significant? No,
No.
nothing of that.
not
that
excessive.
Not excessively, okay. Did you have any numbness or perhaps like anything that you were realizing in your feet or any burning sensations or anything that you were realizing?
No.
Not really. Nothing of
No,
that nature.
no.
Okay. Any other pains or in your chest or back or anything else? Anything that you can sort of tell me about?
Not really, doctor, no.
Not really. Okay.
Just, the night sweats and just fatigue.
Okay.
Yeah.
Okay. You said that you had a cough that came about recently. Did you realize that there was pain when you were coughing or anything of that nature?
Not pain,
Yeah.
but the thing that worried me was about the blood.
About the blood. Okay. And then now you told me that you were given some treatment. So there were 2 courses of
Yes.
antibiotics that you were given.
Correct.
So initial was, I think, something oral. That was
Yes.
for how long?
That was given to me for 5 days.
Okay. Are you aware of what was given, perhaps?
Can't remember.
Can't remember. And then subsequently you said you were given some IV antibiotics
Yes,
as well.
yes.
Any
And-
idea about what that was?
I can't remember, doctor, because they did some tests,
Okay.
allergy test, and then they kind of
So
gave
it
me
was
the
negative and they proceeded with the antibiotic. How long
yes.
did they give that antibiotic?
That was also given for 5 days, and then once I was discharged, I was given some oral
Antibiotics as well. Okay.
I
And
felt better,
okay.
but then,
The fevers came again.
yes.
Okay. And I would like to ask, it says here that you were a diabetic. So how long has that been going on?
I've been diabetic for the past 5 years, doctor.
Past 5 years. Okay. So, did you check perhaps an HbA1c or a fasting
Yes.
recently? How
That
was it?
was 6.7.
Oh, okay, that seems reasonably good. So, what drugs are you on at the moment?
Dimicron and glycoside.
Okay, so it seems to be reasonable. Any other things that you have had, like hypertension, anything else?
No.
Any asthma or anything that you had as a child?
No,
Nothing at
no,
all.
no.
And any surgeries that perhaps you have undergone?
No surgeries.
No surgeries at
No.
all. Do you have any allergies by any chance?
Yes, doctor.
To what?
Penicillin.
Penicillin, okay. And then, so have you been tested? The allergy has been tested. It has been a
Yes.
significant allergy, or
I reacted to some drugs,
You
and so then
that
they
time.
told me that I have to be very careful about
Okay.
it and not to take it again.
not? Okay. So other than these 2 antibiotics, are there any other drugs perhaps that you have been on? No.
Other than for my
Yeah,
diabetic
diabetes?
tablets, no.
Nothing.
And antibiotics, no.
Not really. Okay.
Yeah.
So you said that you're 38 years. So can I just know, are you married by any chance?
Yes, I am.
Do you have any children?
2 kids,
How old are they?
10 and 12.
Do you do any occupation at the
Yes, I'm a nurse.
nurse? Okay. So how long have you been doing that?
Well, ever since I started my career. being a nurse.
Okay. So where do you reside by any chance?
I live in Ratmalana.
Okay. So do you have any pets perhaps or at home or any birds or anything at home?
Not really.
So
no.
you don't have any pets or
No,
anything?
no.
So just for my interest, have you had any recent travel perhaps out of the country or within the country?
Well, not out of the country, but a month back or so, I went to Jaffna.
Oh, okay.
Yeah.
So what were you doing? What
We
was
just went on a holiday. Doctor.
Okay. So was there any travel to perhaps deep to the seashores or?
Yes, we did. We
Okay.
did.
Was
Because
there
we
any,
wanted to show the kids around and
okay.
things like that, so we went around. To
Was there any perhaps bites from any ticks or anything that you have any recollection of?
Not very sure.
Not
doctor.
sure. Okay.
Yeah.
You said that you were a nurse. So which type of ward are you working in?
I work mainly with a TB ward.
TB ward. Okay. So do you all take protection or use protection perhaps or?
I think I'm guilty of that, doctor. I tend not to wear a mask.
Okay. Have you ever been diagnosed to have TB by any chance at any point?
Not really, no.
Not really, okay. Were you tested by any chance with these
I haven't.
fevers? Was there a
No,
concern
no,
of that nature?
no,
Never
no,
been tested?
no.
Okay. So what do you feel is going on with you?
I don't know, Dr. I'm also very concerned because it's been going on for almost 1 month and I haven't gone to work for the past 2
Okay.
weeks, and it's really affecting my whole life, and so it's becoming a bit of a problem. I'm not being, I'm not properly functioning as I should be functioning, and so I'm really worried, since I saw the blood with my sputum, I was wondering whether something like cancer or something like that, I don't know, so many things go through my mind.
What brought about that concern? Like, was there someone
Because
in the
of
family?
the blood that I saw in my, sputum.
You didn't have any family members who have perhaps had malignancies or anything of note in? No, not really.
Not cancer. My dad has diabetes.
But otherwise
no.
What is your main concern here?
I want to know what's wrong
What's
with
wrong?
me because I need to get back to,
Okay.
get some treatment and get back to being normal once again.
So what would you like from us here?
I don't know, what can you, can you tell me what's wrong with me? Because I've gone through 2 courses of diabetes, antibiotics, and I get short relief, but then I'm back again,
Okay.
back again to the same old being sick and sweating at nights and not being myself. So I just need some solution to my problem.
So, one thing is we can give, I would have to go through a few more investigations. But
You have 2 minutes more.
Okay. So considering that you do work in a TB wards, I would first like to exclude that. I do still think that cancer is a bit down on the list, but I still think that we will have to look at TB as a very high possibility because we are living in Sri Lanka and it is quite common. So that is a very high possibility, and it's also a very much treatable one. So it is quite treatable. So I think, I would think of trying to exclude TB as the first option. So I'm thinking along that lines, but again, I'd have to confirm with a couple of investigations. So
what are the investigations you would be doing,
we would
doctor?
usually be going with an X-ray. I don't think it has been done so far with you. And also a couple of sputum tests. So you are probably aware of the AFPs and the gene experts. So we'd like to run those tests.
Okay.
So based on, and perhaps a MAN2 test, I'm pretty sure you're aware of. So based on how positive those tests are, then we'll decide on how we are going to be treated or not. And if they turn out to be negative, then we'll have to go through a few more other investigations and see what we can do next then. So I do not think that you probably have cancer, but I still think TB is probably the most likely one, but then we'll have to go through a couple of tests and try to figure out what to do next.
Okay, so doctor, if that is the case, I'm with my kids, right? I stay with them. Will they catch it or?
The thing is, we'll have to inevitably test everyone in the family. So that will probably include your partner, your children, and whoever else who is living at home. So if they are in fact positive, so we can always treat them. It's quite a treatable illness, so we can always treat them. So that's, I think, probably it will be much more, I don't think it will be a problem. So if we do detect any of them with a timely treatment, we can completely cure any of all of them.
Okay, thank you, doctor. Thank you.
So you have 1 minute. You can recollect your thoughts and prepare for the discussion, right? Right. So what do you think her problem is due to?
So considering the fever and the fact that she's having these night sweats, and also considering the recent sputum with blood, I feel that, and also the strong contact history, considering that she's a nursing officer who is working in a TB ward, and also considering the local prevalence, I think she's probably having tuberculosis. That would be my first differential diagnosis. And then whether to consider other differentials, like isolated lung pathology, some sort of chronic lung infection. The most probably, again, number one would be TB, and other things for me would come very, very low down on the list. So TB is the most likely possibility for me.
What are the differential diagnoses?
Don't have much. Any other connective tissue disorder is still a possibility, but the nature of the fever makes it a bit unlikely, and those are the two. Those are the two things, and some sort of malignancies are also a possibility, like a lymphoma. But again, she doesn't have the other symptoms typical. Any other symptoms that I could think of lymphoma. So I would think of TB, lymphoma as my first two, and then perhaps connective tissue disorders. A bit unlikely there.
So any pulmonary malignancies?
Pulmonary malignancies, for me, the problem was why would come up with a fever, the long-standing fever.
Can malignancy present like fever?
It can present, but the nature of the fever was my concern. It tends to be more of a low-grade fever if it's due to an underlying malignancy.
So do you like to consider as a differential or not?
Probably as a last differential, but first, not at a first differential, at a last differential. As a last differential, yes, but not at the beginning.
Right. So now now she's a young lady, no?
Yeah.
The 38 years old
38,
lady.
yeah.
What are the risk factors in her case to develop tuberculosis?
One is the prevalence in this country, the place that she works in, there's occupational exposure definitely. And third thing, diabetes is a well-known risk factor, which if there is a latent TB, it can quite easily reactivate. So those three are the risk factors that I can identify in this patient.
Right. So now how do you investigate this kind of patient?
Running with a targeted investigation towards TB, I would consider starting off with a chest X-ray, MAN2, and sputum investigations, but on a broad.
What is the useful of MAN2 in tuberculosis patient?
In a patient who has not been previously diagnosed to have TB or previously not been tested with tested with a MAN2 test, then if the MAN2 test is positive, it can be used as a ancillary investigation, but we usually need bacteriological confirmation. So if the sputums are positive, we usually consider a diagnosis of TB, but if they are in fact negative, we can use other ancillary investigations along with imaging and MAN2, but we definitely need bacteriological confirmation for diagnosis of TB.
What are the newer the technique of confirming the tuberculosis?
If it's latent TB, there is a place for things like quantiferon, the gold test, but again, it's mainly reserved for diagnosis of latent TB or for exclusion of TB rather than for pure diagnosis. Diagnosis still requires bacteriological confirmation in sputum samples or whatever samples that we are dealing, or a histological assessment.
Now, apart from diabetes, do you like to consider any other immunodeficiency status in this patient?
I didn't ask for a history of high-risk sexual behavior, so HIV, things like underlying immunodeficiencies, like acquired immunodeficiencies like HIV are a possibility, and then inherited abnormalities like immunoglobulin deficiencies and even other T cell defects which are inherited, a bit unlikely considering that she has not had any past history with infections or any other sinopulmonary infections which can, if they have those underlying immunodeficiency conditions, then they are at high risk of perhaps getting. Other one is the acquired immunodeficiency. Those are the two things that I can think of actually.
So, do you think you could answer her concern, all the concern?
Perhaps some of her concerns, but I think her main concern was more to do with her family and the children. So I'm not sure whether I adequately addressed that particular concern, particularly if the children are also positive, and how the treatment, if the entire family has to be subjected to treatment and testing, whether I address that particular part sufficiently is a bit of a concern. Yeah.
Suppose she was... Right, so that's the end of the discussion. And yes, so we'll have some discussion about this kind of observed history taking the exam, right? And how do you feel about this case, you know?
I think I missed a couple of things about the high risk. I should have asked about the high risk sexual behavior and those things I should have asked. I'm not sure that part, yeah, is the concern.
Do you think you have done well, or do you think you can do better than this?
Probably can do better.
Right. So have you practiced this earlier?
Sorry, sir?
Have you practiced this kind of, observed history
Not
taking?
much, sir.
Not much.
Not
Right.
much.
So how about time constraint? Do you think this time is enough to take the history?
Time was adequate. I sort of felt adequate. Time was adequate.
Adequate.
The time was adequate. But I think I would have better structured the history taking a bit more, because I sort of felt I was flitting between certain topics up and down. So I could have been a bit more uniform in the way I was taking the history. So I was going up and down in some areas. So I think I need to develop that uniformity a bit more.
So how do you feel about the surrogate?
I think she gave a very convincing story, and the history
the
was
story
very
given is very clear for you.
Very clear and very convincing, and she also responded to whatever questions that I asked in a very coherent manner. So yeah, that was good.
Right. Okay. So I think you have done well. That's what I feel. So apart from few shortcomings, but you have done fairly well, right? So now main thing is the rapport between the patient and the doctor, right? So and the empathy and the concern, those kind of things you demonstrated those things. So that's what I observed, right? And your facial expressions also good. Always you have to good eye contact, and when communicating, with a very smiling face, that kind of thing I observe, right? And the other good thing, you allow patient to talk. At the beginning, you ask few questions, the repeatedly you ask some questions, so that is something that you better avoid, right? Because always allow patient to give her own history, rather than interrupting the history. For example, what brought you here to this hospital? Allow patient to talk, yes, and prompt her, encourage her to talk, right? Because by that we can get a lot of information, and that's a good way of taking history. So allow patient to talk. Rather than we talking, allow patient to talk, and avoid as much as possible the close-ended question. Always try to give open-ended question and avoid close-ended question, right? But anyway, you are good, but those are the few things that I have to tell. And so as a doctors, and as a all of us, from the beginning, from the medical school days, and till you become a doctor, and after you become a doctor, when you're doing the PG, so whatever, you are doing this art. We are continuously taking histories. But again, even the MRCP exam, they have shown a lot of failures in this station. So we have taken a lot of histories, but the statistics have shown a lot of failure in this station. So because there's a given time is there, and you have to structuredly, you have to take the history. And so not only the history component, there are various aspects we assess. There are different domains. When you go to the MRCV, the marking scheme also, you can observe that. We check various domains. And knowledge is only one thing, but communication skills and everything will be assessed here. And so those domains will be marked and finally convert into the marks, and then whether you are going to pass or not, right? And so always the main way to get a good result is practicing. So if you go to the internet also, there are various structured histories you can see. So always try to, rather than reading, practice like this. Two of you can get together and time according to the MD exam, because now your main target is MD exam. So time according to the MD exam, and practice, if possible, record it. You can record or video, right? And then what are things you could have asked more, and what are the areas you forgot, right? And so like that, 2 or 3 people get together and practice this. I think that is the main way to improve the communication skill, right? The observe history taking and the communication, both you have to talk, right? And those are things I had to highlight. Any question from you or audience? I think there are a lot of MDs here. Now you are preparing for the MD as well as MRCP, right? it's free to ask, anything you can ask. So this is the way to conduct the exam. Right? About 15 minutes, the examiners are silent. Last 5 minutes only they start to talk. You want to ask anything? No. Any queries or any clarification from the audience? Right. So in the absence of any queries or questions or clarification, we wind up this session. Thank you very much, Subhani, and so all the best for your exam. And all the junior, our colleagues, all the best for your forthcoming examinations, right? Right.
So moving on to the next segment, we have communication skills. So I would cordially like to invite Prof. Champica Bodinayake on stage as the examiner, Dr. Semini as the candidate, and Shehani once again as a surrogate. In the interest of time, Semini has already got 5 minutes to go through the station. We can start now.
Hello, good afternoon. I'm Dr. Semini, the registrar in this general medical ward. I am the doctor who's attending Mrs. Silva currently.
Yes,
And I heard you are one of her family members.
I am a daughter. Yeah.
Yes. May I know your good name,
I'm
please?
Shani.
Yes, Mrs. Shani, are you employed somewhere?
Yes, I am, but actually I'm very angry and annoyed right now, and I really want to know what's happening with my mother.
Okay. Let me ask, is this setting comfortable for you to
Yes.
have this conversation?
That's
and
quite all
is it
right.
all right if I speak in English?
Yes.
And it's quite all right if you need someone to accompany you in this conversation, a friend or a relative maybe?
That's okay. I just need to talk to you and find out what's wrong with my mother, because I hear that something has been done with her, but I'm really angry and I just want to know what's happening with my mom.
Yes, Mrs. Shani, I can totally understand your situation. First of all, let me ask, did Mrs. Silva has any other illnesses apart from this current
Of course,
situation?
she's been having, she's been having pressure, and she's been taking her medication, and she has not had any problems with the pressure. Of course, she's been taking her pressure tablets and aspirin, and she's been faithful to her, she's been prayerfully going for her clinics, and she's not had a problem before. And just last month, I took her to the doctors, and then she said she had a dizzy, she was feeling dizzy.
Okay.
But, you all ignored her completely.
Okay.
And just said that she has an ear imbalance.
Okay, let me get into the problem. Has she been all right at home before this incident? Like, has she been performing his day-to-day work?
Yes, she's a very active person. She's been doing her usual thing until like last month, when she said that she was having this dizziness, and I took her to the doctors. They said, oh, nothing, don't worry, it's just a ear imbalance. And they did nothing about it except give her a few medication. And now she's facing this situation.
Okay. And just to recollect the thoughts, can you brief me the symptoms that she has been experiencing for the last couple of days?
No, just yesterday, and like she was having severe headache and she was vomiting. And next thing I know is like, she was really bad, and I had to admit her into hospital. I had to rush her into hospital. And yeah,
Yes,
and
Mrs. Shani.
I feel she's like,
Yes, so that she has had this headache and vomiting during past couple of days, which has brought her
just
to
yesterday,
hospital.
yeah, yes.
Yes. Mrs. Shani, it's perfectly all right. I can understand your situation currently. You can take some time off
But I need to know what's happening with my
ease
mother,
your
doctor.
thoughts.
Yeah, can you tell me what's happening with my mother?
Yes, Mrs. Shani, I have seen your mother, and we have performed some tests on her, and we have performed some imaging. As you must be aware, a CT scan that we have done for her to see what has gone wrong with her. So I'm afraid I don't have good news to deliver to you. This CT scan, this test has revealed that there is a growth inside your mother's brain.
How can that happen, doctor? Why wasn't it detected before?
It could have been a symptom with this condition, Mrs. Shani, but usually the patients who are having these kind of growths in their brain, they usually have some alarming symptoms, like maybe severe headache in the morning hours, or severe vomiting, or maybe some visual problems.
Yeah, but when she was told about it last month, when we went to the doctors and we said that she has this disease spells, why didn't you all do this, test or whatever?
Yes, Mrs. Shani, I can understand your anger, and at the same time, as I have mentioned you, there are certain symptoms that patients may be having with these condition. So this dizziness that your mother has had may have been linked to this condition, but at that point, I think the likelihood of having this growth in your mother's brain must have been very low down, like they have not considered, as she was not that symptomatic, I guess. But still, I would like to go through her clinic records and see whether what symptoms she has reported at that point, and see whether there has been a mismanagement at that point, and discuss with my consultant, and also to discuss with that particular doctor.
It's not acceptable, doctor, because she is now in a terrible situation. She doesn't even, recognize me. She doesn't recognize me, and I feel she's deteriorating. And it's hard to watch her. I can't understand if she's been coming week after week, month after month to you, all of you, and seeing you all and taking her medication. How you all miss this? It's just unacceptable. How can a tumor just appear just like that?
I can totally understand your anger, Mrs. Shani, but there are certain growths in brain which may appear out of blue all of a sudden, which may have been there but enlarging day by day, so appear sometimes out of blue. So those episodes, those dizziness episodes might have been linked to this situation or might not have been. So we can go back to your mother's clinic records and see whether has there been any mismanagement at that point. And
exactly, because if you all had done that, if you all had even asked, requested, because we can afford to do my mother is my precious, something precious to me, and if you all had requested for us to do even a CT scan at that time when she said she was dizzy, we could have done it. Doesn't necessarily have to be through the government. I could have done it privately. So why wasn't it requested?
As I have mentioned, Mrs. Shani, I think the likelihood of a brain growth at that point must have been very low with the symptoms she had. But I can't exactly say I have
so
to go through your clinical symptoms. So you mean to say in 1 month
it has just grown so big, or whatever it is?
I have to say sometimes it appears like that, enlarging day by day. And also I have to brief your mother's condition to you, current condition. Is that all right for me to talk?
Yes, of course.
Currently, your mother is having very low conscious levels.
Yes, I know. She doesn't even recognize me, and that's what's breaking my heart to watch her like that.
Okay. Has anyone told anything about this to you, like the condition that she is having currently?
No, because when I go and see her, I can see that she's not doing well and that she doesn't recognize me.
Okay. Can I get some tissues for
you? It's okay. Thank you.
Take a moment, ease your thoughts. I know it comes as a huge shock for you, a devastating news. I can totally understand your anger and the sadness.
So what's going on with my mother, doctor? What can I do for her? Can we do some surgery to remove the tumor that she's having?
Yes, let's see. As you said, she has had only high blood pressures during previously.
Yes.
And she has been very well, actively engaged in her day-to-day activities. So in the current situation, as I mentioned, this growth in the brain has enlarged so that there's a bleeding inside into the growth.
Now you're telling me she is bleeding?
Bleeding in the sense, as I am to simplify it, like if the growth is getting enlarged day by day, as a complication, bleeding can happen into that growth.
How did you all figure out that?
Actually, we have done some imaging, as I have mentioned, CT scan.
So why
on
has
your
it
mother.
gone? I mean, why have you all permitted it to go that far?
Sometimes things proceed very quickly. The symptoms may happen all of a sudden out of blue. So,
Do you know, doctor, that you all can be sued if this happened? My brother was talking to me and he said, you all can be sued because he lives in Australia. And he said, you all can be sued for what you all have done to my mother because she's everything. And you all have, blown this into this situation.
I can totally understand your anger, Mrs. Shani. At the same time, you have the whole right to proceed it like that. At the same time, I would like to brief your mother's condition. So she's having a low conscious level, like reduced conscious level. Currently, she's maintaining her breathing, and we are keep on looking at her status very frequently, like heart rate and everything. We are looking after her. At the same time, we have started some medications to stop the bleeding, at the same time to reduce the swelling of the brain. So I think she might respond to that. At the same time,
What is causing the bleeding, doctor?
bleeding, of course, as I have mentioned, it may appear as a complication, like as a sequelae.
So is it because
To
of the
this
aspirin
brain
she's been
growth.
taking? Is it because of the aspirin?
Has she been taking
Of
aspirin
course, she was
regularly?
asked to take aspirin as well. I don't know, that was what the doctor requested.
Okay, it might have been attributed to the current condition, but I cannot say that is aspirin per se. So we may have to stop aspirin, and we have started medications as to stop the bleeding and several other medications. At the same time, we would like to contact and get opinion from the expertise neurosurgeons who are doing surgery on brain, as whether the patient can undergo any surgery in view of recovery. So I would like to arrange a meeting with my consultant, at the same time neurosurgeon, immediately to decide on patient's management.
So will you all do some, once the bleeding stops, will you all do an operation to remove the tumor? Because
That of course we have to take the opinion from the expertise in the field, like the neurosurgeon.
but there is no time, doctor. If it happens so fast within a month, if this has got so bad in such a long time, why are you waiting for so long?
No, we are not waiting. Actually, we have already arranged a multidisciplinary management team. Like we have taken opinion and gathered other teams, like the surgeons who are operating on brain and the neurologists and our consultant.
Okay, so you're going to do a surgery then, and I should ask my brother, because my brother lives abroad, so I should ask him to come down and be here as well, because if she's going to undergo surgery, I need him to be here.
Yes, Mrs. Shani, as I have mentioned, I'm not at expertise to say whether she needs surgery or whether she should undergo surgery. So I have to take opinion from my consultant, at the same time surgeons who are operating on the brain. So after the collaborative decision only we can say whether she's undergoing surgery.
So you all are not sure whether she's going to undergo surgery either?
Hopefully.
Should I take her to a private hospital then, if that is your, your answer?
At this point, Mrs. Shani, I cannot assure whether she would undergo surgery because it all depends on the opinion of the expertise in the field, like neurosurgeon. So, considering her previous illnesses and the functional status,
Only
she has
thing
been all right. So,
Yeah, because the only thing she's had was this pressure, and then 1 month ago, and you all are telling me all of this, which is not acceptable, because if you can't do it, tell me, I will just take her privately and we get it done privately.
you have the total right to do like that, Mrs. Shani, but currently your mother is not doing well. Her conscious level is very much reduced. So if you are to take her to private hospital, I would have to discuss with my consultant and let you know the decision.
So what's the solution then?
So currently we are arranging a meeting as soon as possible with the neurosurgeons to take opinion regarding the surgery. At the same time, we have started medications as I have told you.
Thank you.
Thank you.
You have 1 minute to think. Are you ready?
Yes, madam.
Right. Was it difficult?
Kind of, madam.
What do you think what does the audience think about, anyway, I'll finish with the candidate first. So, did the encounter go all right for you, or did you find it difficult?
It was a difficult scenario, madam. She was very angry as her mother has been experiencing some symptoms at 1 month back, but it was apparently not taken into much of a consideration. So she has not undergone any imaging at that point. So she was really angry about
So
that.
why was the daughter very angry? Why, in your opinion, why was the daughter very angry?
Actually, this incident is a huge shock for her. It's a devastating incident. So she's in the grief reaction. So she's like trying to find out some fault at some place and like she's just experiencing her grief. At the same time, there could have been some mismanagement at some point. So
Do you think that there had been a mismanagement going on as well, which made the daughter angry?
actually, madam, as I have told, she didn't have any much alarming symptoms as for brain tumor. So probably doctors wouldn't have thought of a brain tumor at that point.
So the symptoms was not significant enough to suspect a brain tumor?
I guess so,
Right,
madam, not
okay.
for undergoing imaging.
Okay. Any other reason that the patient, is she only angry, or any other emotions that she displayed to you?
She is actually sad, very sad, madam.
Why do you
She's
think she's sad? Why do you think that she's sad?
like mother has been quite all right despite she's had high blood pressure which was under control, so it must be very shocking for her to see like this, madam.
Right. So, in your opinion, is there a medical kind of a misdiagnosis also? Do you think that there's a misdiagnosis going on?
In my opinion, madam, as I have mentioned, since it was a very low likelihood of brain tumor at that point, I don't really think there
You
had
really
been a
don't think it
mismanagement.
is so.
Still,
Right. So, is it kind of a delayed diagnosis?
kind of, madam.
Kind of. So, do you think if the diagnosis was made kind of earlier, would it change the patient's prognosis?
If it was diagnosed earlier, madam, the patient, considering her functional status, like she has been quite functioning well despite having high blood pressure, so there might have been a possibility that she had undergone a surgery, but I'm quite not sure, madam.
You are not sure. What makes you not sure? What are the things that are which might tell that surgery will not be a good idea?
Like age and the hypertension, and now that she has developed a bleeding into tumors, that shows that the tumor has been a very large tumor, which may have been inoperable at that point. So, but
If she had asked whether her brother should visit back, her brother lives abroad, visit to see her mother, what would your answer be like? Should you ask the brother to visit her or not?
I think it would be better, madam,
You
if
think
the
it's
brother
a
to
good
visit,
idea?
like as the outlook of this current situation, the patient is not doing well. So I actually, of course, would advise her to get the brother.
And she was asking to do the maximum for her mother. And do you think, what do you think in your opinion maximum care would be like?
First, I would take the opinion from the neurosurgeon, as I have mentioned. If they are not going to operate, madam, I would have to discuss with my consultant in terms of deciding whether the patient needs intubation in setting of deterioration, madam. So,
Right.
given the age, comorbidities, and the poor outcome.
Right, okay. Right, so we are out of time now, so we'll finish. What does the audience think about the encounter? Was it a very easy surrogate? It's not an easy surrogate. It's very difficult to negotiate that surrogate, isn't it? And communication skill is different from the history-taking station. Either you have a very angry patient or a sad patient or a tearful, confused. So the same surrogate acted in two stations, but entirely differently, right? Okay, so that is a communication skill. So let me show you a few things that Tushara, can you just move the slide? So what is assessed in a communication skill? If you are very good, it will be over 70, and if you are very bad, it will be less than 30, right? And then you have clear fails, bare fails, bare pass, clear pass, and excellent. So that is your marking grade, right? And as you know, it's the introduction and exploration of current understanding, right? I think Semini did try to explore. She spent a lot of time on, waiting till the patient gets settled to tell what she wanted to tell. There was a little delay because she was trying to, sort the patient and settle the patient, make her little peaceful for her to talk and tell that. So this is not entirely a breaking bad news, because from the history you would have noticed that the bad news was already given by the nurse. Staff nurse has already given some bad news already given. So what she needs is to explore it a little bit more with the daughter, and to get the daughter to understand that there's a huge brain tumor and there's a bleeding inside, and to make her come to an agreement for your agreement plan, for your treatment plan. So that is one thing, right? In addition, she is pretty angry that there had been a misdiagnosis or a late diagnosis late, and so that is another thing. So she was trying to deal with that as well. So whether there had been a very error, whether you had caused an error at the clinic doctors, but the symptoms had been very minimal. So Semini was trying to explain, the symptoms were not so obvious, so therefore it is possible to make. What if you had actually made a diagnosis, misdiagnosis, and you said something entirely different, right? And you entirely missed the tumor, how would you act? You entirely missed the tumor. The patient had some symptoms of raised intracranial pressure, and the doctors entirely missed That also could be a same kind of scenario. Then how would you act? Would you apologize? Would you apologize? Yes. You have to be very truthful, isn't it? Duty of candor, I hope you have heard of, right? So the doctor will have to apologize and then, of course, explain the situation and try to make arrangements to recover that mistake if possible. So that is the underlying principle if there had been a misdiagnosis. So here it was not very clear whether it had been a real misdiagnosis. So there's a little gray area that you have to explore. So we don't give cases very black and white. So there's a little grayish case. Then if there had been a kind of regarding the daughter's concern about surgery and very high end treatment, there you will check the candidate's knowledge also. So what would you say regarding ICU care? She's asking for surgery. What do you think? So what is the ethical principle underlying here? So you do good, but do no harm. There's a huge tumor with a bleed inside in an 80-year-old person. So it's obviously that is expected to check from the candidate's knowledge that it might do more harm. It's okay to tell that we will discuss with the neuro team. That is perfectly all right. But you must not be giving the daughter false promises that surgery will cure or ICU. So don't promise. So that is not truthful. So there are several things which underpin this case. So all those things are important. And then last one is whether you would ask the brother to come, what would you say? You have to be truthful, right? So that is truthfulness. So considering the patient's condition, would you ask the brother to come? Definitely. So in this case, the case will be explored. Why did the person act like that? And the candidate might give answers from her understanding. And then the examiner will also explore certain principles that underpin something like duty of candor or truthfulness, non-maleficence or do no harm. So all those things are under. So those things will be explored. So those are part of it, but it is not the whole part of it. Communication skill is communication. So how empathic you are and what are your verbal and non-verbal gestures, and most importantly, the listening skill. So this is it's the listening skill, right, that you would be checking. Tushara, can you change the slide? Is there another one? No. Sorry. So listening skill, I think I have missed few things. So these are the parts that your tone of your voice, right? That is very important. And your pauses and pacing, right? You have to pause, stop, listen, give a tissue. So those are very important in a communication skill. Please don't forget. And checking for understanding. Don't use any jargon. So those are important steps. And when you are starting, you must first explore the patient's idea and the concern, right? And expectations. So that is called ICE, right? Ideas, concerns, and expectations. So those have to be covered at some point. So, you're building the rapport and you're starting and end. So that would be the finishing of the case. So I would say that 40 marks is the minimum for a communication skills station, and this is one of the easy stations so that you could score more. So better not to underestimate, but practice as Professor Ralapanawa already explained. Thank you.
Thank you. I really hope that you all took a lot from this session, and I really thank Prof. Ralapanawa and Prof. Bodinayake for coming all the way from Karapiti and Kandy to give this realistic experience to you. Can I have both the resource persons on stage to receive the certificate?
Thank you, madam. That concludes the first day of the academic sessions of SIMCON 2023. Hope you all had a great day today. Hope to see you all tomorrow, 7 a.m. at the same time, same venue. Thank you so much.